Hello there, it's Elizabeth here on the Dandy Soap Herb Shop channel. And it's been a while since you talked to me. We've been talking about inflam- cha- bleh. we've been talking about inflammatory breast cancer, stage 3, and also invasive ductal carcinoma. This is when you can potentially have more than one cancer within your breast. And so I was diagnosed this on June the 1st. I've already talked to you about my chemotherapy treatments, what that's entailed, my catheter, and different things. Today, I want to talk about some of the things you can expect by the time you reach your third chemotherapy treatment. And I also want to talk to you about some of the tests that will determine your cancer, the depth of your cancer, if it has metastasized, and how they come about and collectively have all this information. And then that way you'll have a general idea of something you can expect that's going to come up once you become a breast cancer patient. And that will kind of help you kind of see, okay, so what's next before any of this starts? How do they come up with all this information? What do they know? And things like that. So I think this video will give you some of the answers there. And no matter what your breast cancer is, chances are you're going to go through this entire series of tests. And these are some of the tests that you can expect to get. Now, you have already gone through a biopsy. You, of course, had probably an ultrasound. You probably already done the mammogram, a 3D mammogram, which is a very intense mammogram. It really pulls it up hyperly for them to see the minute, smallest indication of calcification. Generally, where there is calcification, there is indeed cancer. That's kind of the guideline that they go by, or what how they predetermine. So then, of course, you'll endure biopsies, and they're not a fun factor at all. Matter of fact, if you're like me, just do the surgery. I just prefer it over biopsy. Biopsies are painful, they're uncomfortable, they're almost primitive. The way that they gather the biopsy is just so primitive. You feel like a lab rat, really. And but those have already been done. So now they have told you you have cancer, they've told you what kind of cancer, and now they are pretty much lining up. Probably by this time, you've already met with an oncologist, you may have even met with the surgeon, and they've told you your cancer, how they're planning on treating it, and what's going to happen to you. So the tests that they're going to start putting you through are making sure that they've covered your body from head to toe. So you will endure an MRI. That is really important. MRI for a breast screening is intense, and it puts you in such an awkward and uncomfortable position. If I can, I will put an image of it here, but I highly recommend that you just simply Google um, breast imaging or MRI breast imaging, and you will see the awkwardness, and you will see how they set you up on the machine, because you really truly are in the most vulnerable position you will ever be in your life, and there will be no friend in there holding your hand. You will be completely alone, and it is scary. It's upsetting. So if you cry, cry. That's whatever gives you relief. Because I'm going to tell you, your humiliation is at an all time high. It is one of the most humiliatingest positions and tests that I've ever been through in my life, and I thought I'd been through a lot. But no, it's quite humiliating. It's very, very humiliating, because you first have to get onto this machine. You will be on your knees. You will be in a laid out fashion to where your hands are completely stretched in front of your head. Your breasts are placed into dividers. There will be a metal bar, and a lot of times The only thing that they will put there to cushion it is a washcloth. And I'm not joking. I'm not even putting on. It is not padded. It is solid metal bar. It is a square metal bar. And if you are well endowed, uh, I don't even know what to say. And for someone who's not well endowed, that's going to be painful because either way it's painful because you have this metal bar going here and your sternum is laying on it, and these cavities your breasts are put into. So unless your facility has a more advanced method of this MRI machine, I'm telling you, it is the horriblest thing ever. I mean, pretty much I think they put me into probably the oldest MRI machine available. It's the loudest thing I've ever been in. I've had other MRIs and they were nothing like this thing. So I think that this was just a one that's been used and used and used, and they just don't have no mercy on you really. So hopefully your facility does you a better justice. There's no padding. You're literally You're like laying with this bar here. The only thing that's holding this whole upper half of your body. Now you're laying face down. You have to remain that way for about 40 minutes. They're going to run a contrast dye through an IV in your arm. So it'll be one arm or the other. They don't care, whichever one they prefer the vein as the vampires do. And that contrast is a sugar type dye that literally lights up anything that's cancer. Seriously, like it is intense. Um, what you see, that don't hurt you or anything. I mean, put the IV in you, and then when they get you to the machine, get out of it. They hook up the contrast dye to run into it, and they tell you when that contrast dye is going to run because they need you to squeeze a ball, which they will place close to one of your hands, and you'll hold that ball, and you will press it if you happen to feel that dye run on your body because that means that the line let go or something didn't work out with that. But they'll tell you all that. There's generally about 3 people in there. They will be female, of course. Even if they're male, just know they know what they're doing. They've done a billion times. You are not the first, and you won't be the last. Um, Unfortunately. So you'll be knees down, stretched pure out, arms above your head, fully stretched. And like I said, this is a bars in your sternum, and then there is a little miniature pad plastic thing holding your head. That's literally the only thing holding you up, and it's heightened, and it just looks like a little plastic basket with a little pad right here, to put your head on. And you're going to have to stay in that position. You can't move. You got to be still. Now, these idiots will actually go, oh, we're going to give you, some hearing buds, some little earbuds, and we're going to run some music through it. What kind of music do you like? And they'll name off the stuff. And I'm telling you, the machine is so loud that really you can't even hear the music. You can't make out what it's doing. So, and then they put these earmuffs, these padded, fat earmuffs over top of that to try and do away with the noise of the machine. That thing pops, cracks, and it makes the god awfulest racket, noise. It is just, I cannot believe that as advanced as our medical system is, that that's the BS we still have to do. It's stupid. Because the funny thing is the other test that you were to do, like a CT scan, it's an MRI machine with contrast. They lay you on your back. They scan this part, and it's called they'll call it your skull, chest, and then they'll do the lower half. They'll do your pelvic. It takes 10 minutes. It's the most pleasant thing I endured the whole time. So you'll endure that test. Okay, then there's the bone scan test. The bone scan test is quite interesting too. Once again, it is a type of radiated contrast. It is a radiation formula, and they have to give it to you 3 hours before you're actually scanned, and that's for your bone scan. That lights up your entire body. Pretty much that dye they put it in, so they'll ask you to not do this and that and other, and come for that test. So you'll take that dye, they'll place it into your arm, they'll run it in there, and they'll just like give you a bandage, they'll band-aid it off, and then they'll tell you go eat, drink, do whatever you want to do for 3 hours and be back there at approximately that time, because it takes that long for that dye to run throughout your entire bloodstream, and then that way it truly lights you up when it goes to scan. Now, these tests are very important. Now, I know you by this time you are going to be so emotionally, mentally, and physically challenged because your emotions are heightened by the very you literally go deaf. It's true. You go completely deaf. You hear nothing after they tell you have cancer. You don't. You don't hear anything because your world just blew up. It like just imploded. It just imploded. It just imploded. And you're trying to take all that in like you're thinking oh my god, oh my god, oh my god, like you really are just shocked, and you don't know, you're scared, uh and you're such a state of shock and so scared. You may cry, you may be bewildered. There's 10 different words I can give you to describe how you're going to feel. And you, like I said, your life just came to a stop. I mean, literally, like maybe before then you were going through your checklist of all things you got to do and all things you need to get done, and, like truly. So on that day when you receive that news, nothing has significance anymore. Like literally, nothing. Anything that was important to you, anything that you thought was priority and that was important to you, your everyday life, not anymore. Not anymore. The only thing you're worried about right now is what am I going to do? Oh my God, what's my family going to do without me? Um, how do I deal with work? How do I cure this cancer? How did I get this cancer? What's for me now? Do I have a future? What's going to happen to me? You truly. So these tests they run you through is giving you a sense. By then you've already known about your cancer, you know what's going on with that, and now you're going through these tests. So these tests, at this point, you're just petrified of that test revealing that you have cancer somewhere else other than your breast. And so you're just trying to deal with that. So I can tell you right now, every time I went for a test, I'm anxious to get that done, get it over with, not really knowing what to expect or what they're going to do, but just knowing I got to get this done. And then at that point, I'm just checking to see if the test has come in. What does the test say? I'm now becoming my own radiologist and pathologist. And that's what you do. That consumes you. All that other priority stuff, it took a hike. Now it's about what you got to do and what your tests are saying, and if you have any more cancer and where's it at and what do we do with that. That becomes your priority. So you're anxious about these tests, and at the same time you're terrified of these tests. What are they going to say? Is it gone to my liver, my lungs, is anywhere else? So my test did find that there was questionable things, like on my thyroid. But in talking to my oncologist, the reason why she didn't even worry about or discuss it with me is think about it. They're throwing at me the most strongest chemotherapy that I can possibly tolerate without dying. And so it was a matter of let's make sure she don't have an allergic reaction. Let's make sure that she can tolerate it. And so their mind's eye, whatever's in there, that chemo is going to hit it anyway because they're already giving me the strongest thing they can give me. And that is why I wanted to tell you these tests you can expect. So you will have all these major tests. They will also do a echo on you. This is a ultrasound, no no contrast dyes needed, and they will check your heart. Now the reason why they're checking your heart is they need to make sure of all of your very vital organs are okay. There's no problems when no issues that would prevent them from inserting a catheter in you, so that when you start taking chemotherapy, rather than damaging your veins, they put the catheter in there so that they can administer your chemotherapy directly in your body. You also have to remember that the chemotherapy, certain ones of them, if it were to touch your skin, come in contact with your skin, it is going to injure you and burn you severely. It is very dangerous. And for it to be outside of the body or outside of an encapsulated or package, that's airtight and liquid tight, it would be dangerous. They do wear biohazard draping and so forth, robing and gloves and masks and everything, goggles, the whole deal, when they go to put your medicine, the chemo, into your catheter. So they do the echo heart test to check your heart to make sure there's no blockage, nothing preventing or would interfere, in order for them to map out it's okay to install you a catheter to administer the chemotherapy treatments and to draw your blood tests and things like that, which that will happen to you every single chemotherapy treatment. They will draw blood. That will go down to the lab, and it's generally checked before they administer your chemo to make sure that your blood platelets and your liver enzymes are okay, and that you're okay, and that you can handle it. So there's so much involved in it, in your treatment, and going forward with after you find out your diagnosis. I know how you feel, and I have offered to you to leave comments, to contact me. I leave my contact information, or my website rather, where you can get the contact information for security reasons. I figure if somebody takes the time to go over to the website and see the front page showing the phone number, then that's someone who's serious, and they're not trying to spam me, they're not trying to harm me, or that they truly want to take the time to contact me. Additionally, one of my goals is if you have been diagnosed with cancer, I would love to send you a care package. There are some things that I would like to send you that are going to help you. Um, they'll comfort you, and they'll also let you know you're not alone. And there are organizations out there where your loved ones can submit your name and get these care packages. But since I am a cancer patient now, and I pray to come out on the other side of this, one of my things, my future ambitions, starting now, is to also give love and concern and true sincerity in sending a care package, especially with the dandelion soap herb shop products that can be beneficial to someone suffering cancer. And I don't care what your cancer is. I don't care if you are male, female, or child, senior, or adult. It just let me know that, and I will send a care package. I would love to talk to you, or you can send me a postcard, or you can send me an email, and that way I can ask those questions and get that information. Right now during treatment, you know, I am doing these videos to give back, is and to maybe offer some information as much as I can. While when I have my ability about me, when I've had my chemo treatment, I can tell you for the first 9 days, no, I'm down for the count. I am fighting sickness. I'm fighting nausea. I'm fighting to keep from vomiting. I am shaking. It affects my nerves. In my motor skills, I sound lethargic. Because I can't make the letters and stuff, and all that is having to do with chronic fatigue. I'm also trying to make sure that I am allowing my body the permission to just accept the chemotherapy and let it pass through me and get my bowels regulated, because for me it was constipation, not diarrhea. Now I'm taking my final chemotherapy treatment tomorrow on the this will be the fourth cycle of the Red Devil, and which is the doxorubicin and the athromycin, excuse me, and the cytoxin. So that will be on the erythromycin, and the cytoxin is uh, they're so layered, and they call it Red Devil. And so my mapped out that my oncologist for my treatments was 4 cycles of that. Now, after tomorrow, I will get, it'll take me 9 days just to handle that chemo and then start being human again. So I'll get that, what you call I call them my honey days. And so at day 14, I will return, and then they will begin the next cycle of chemotherapy. And this will be the Paxil. And mm, that I'm not excited about that. That Taxol is the short abbreviation or generic name for it. That is 12 weeks, and those happen every single week for 12 weeks. That will put me into November. It's August right now, so starting in August, second week of August, and that will run all the way through November. That is if I'm handling it, if I don't have an allergic reaction, if I do not get sick with some kind of other infection or bacterial infection or some kind of sickness, because remember, it suppresses your immune system, it knocks it out. So if that happens, then of course, you're probably going to end up going to the hospital for that. So you try to avoid that, and getting straightened out, and then of course being able to start back with the chemo. It also, during that time, will you've got to make sure that your liver enzymes are okay, that your heart's okay, your platelets, your blood platelets, and red and white blood cells are all staying you know, in check to what they think is acceptable, considering you're taking chemo. And you'll learn all this as things go along when you're taking these treatments. You'll figure it out. Trust me. You'll be your own best student, because you will, if you're human like anybody else, you will go home and you will Google, you will watch YouTube, you will read blogs, you will be searching like a mad person for all the information. You will absorb it like a sponge, you will analyze it, you will dissect it, you'll break it down, you'll reprocess it and feed it back to yourself. You'll constantly be on check. You will then be doing things that you can to fight the cancer and to prevent it. Um, you may look into unorthodox methods of treatment. I'm all for that because I'm doing some myself, and I'll give you further information on that. So you're definitely going to be fighting, and your family is going to be there supporting you and loving you. And I will tell you, when you're diagnosed with cancer, you'll truly find out who truly cares about you. That's family and friends, neighbors alike. You'll truly find out who really gives a darn about you. Now, don't judge everybody, and I'll tell you why. There are some people that now that you have cancer, it literally goes through their mind that that is contagious, that them being around you, that they might get cancer. Another thing is some people just do not know what to say. They don't know what to say to you. And then there's this fear. The fear of, oh my gosh, it's almost like I don't want to go around them because then I'm going to love them and it's going to hurt more. And they will disconnect. They will literally try to disconnect and desensitize themselves to this news of their friend or family member, because they can't handle the pain of the loss. And believe it or not, they're foolish enough to think, oh, I'll just wait until they die and I'll show up at their funeral and then I'll cry. I know that sounds crazy, but remember, you're human. You're dealing with humans. Don't expect any different from them. But you will learn real fast who really cares about you. Family, friends, and neighbors. You will truly find out. You will be surprised at those who really care about you and at this detrimental time in your life, because I don't care who you are. Any type of cancer is a life threatening disease, and some are worse than others. Some are, you're a little bit closer to it than others, where some have, it can be operated on, taken out of them, boom, it's done, and never comes again. You have some that's going to be on the teeter totter there, like it's real close, and they may not be able to have surgery. They may have to have chemo and radiation. Then you have some that may just need radiation and eliminate it and cure it, and then it's just a matter of just monitoring it and make sure it doesn't come back. The same as with a surgery. So I can tell you, anytime chemo is involved, um, that's not the good part of the side of cancer. Being on that side of cancer, that's the real bad part. So now that they have this whole collection of all these tests, and you are getting updates on these test results and what they are seeing on them, if they uncover or discover something, your treatment plan will change and it'll be modified to accommodate that. For example, they seen something on one of the scans that indicated that there might be something in my left breast. And I already knew from my past history and surgeries that I've had on my left breast that it was scar tissue. But no matter what, I could not talk them out of it. And they did a MRI guided biopsy. And I still regret it. I do want to report the doctor who did it, and my breast is still black, blue, purple, yellow from that MRI guided biopsy. That was the worst thing I've ever endured in my life. And I'm telling you, I have expressed my upsetness about that test, about that biopsy. I have more than expressed it to more than one person, and I will keep expressing it, because I am a person, when you hurt me, I don't let go of it. I literally, I am very tenacious, and I will not let go of it. So they hear about it every single visit. I'm going to make daggone sure I'll drive that dead horse all the way 6 feet under. I will not let up, because my left breast had no problems. There was absolutely nothing. I already had scars from previous cysts removed, drainage. I've had abscess rupture in there. I knew it was scar tissue from the tumor that they removed from me over 20 years ago. Way over 20 years ago. And that is why I never went back for MRI. See, when you have bad experiences with medical, it prevents you from doing things that could maybe avoid other things. But I can tell you this. I have been assured by more than 5 medical individuals that had I went for a mammogram 6 months prior to my diagnosis, they would not have seen it. And that is God's saving grace, because they wouldn't have seen it. That by the time something did arise to really give a clue, I probably would have been eat up with cancer. Because remember, within a few months, 3 months or so of my pain occurring in my breast, I'd seen something and been keeping an eye on it, but it wasn't really disturbing, and it wasn't large, and it just really didn't, I don't know, make me think, oh, I need to get this, like I need to get a rush on this. But when I started to experience pain, that is what prompted me. I've got to do something, because I was having the pain, and then it was becoming more apparent. So I was told, and I feel very secure by the time I asked that many medical individuals who specialize in breast cancer, that it is a saving grace that had I went 6 months prior to my diagnosis, they wouldn't have seen it. They would not have picked nothing up. They would not have known it. It would have, it cancer's that way. It's a sneaky little devil, and it can hide away in the most concave places throughout your body. That is why a lot of times it has already gotten to a level of fear factor and dealing with what we're dealing with right now before it's discovered. Cancer's that way. It is a conniving, evil little demon that can dodge and hide, and it can mask itself and camouflage itself. So the first thing I want you to remember is it is not your fault. There's literally nothing that you could have done. And until we and our medical technology gets up to the level of sci-fi movies, cancer's not going to be pre-discovered. And even though they're working in research to try and isolate, if they can predetermine based on your genetics, based on your family's history, based on the DNA, uh, to figure out if there's some kind of genetic marker in there to indicate that this person is going to get cancer. Now, they can give you estimates and probabilities, and it is safer for you to go ahead and be pre screened on a regular basis as often as you can afford, and preventively. If you've had family members who've had cancer, and I mean somebody as distantly close as a great grandfather, you truly need to keep that in mind, because the thing with a grandparent having it or a great grandparent having it, one thing that they do know is cancer, for whatever reason, genetically will skip generations. So your great grandfather may have had it, and that's how come you ended up with it. There's something different in there. But that, and there again with breast cancer, we're talking about they've already been able to discover BRCA1 and BRCA2. So if you are the person who has breast cancer and you fall under BRCA1 or BRCA2, they can run tests on your offspring and see if one of them has that genetic marker, and go ahead and prepare and be treating them so that cancer never happens. That's as advanced as they've got. So, like I said, until we get to where we're sci-fi like, to where they can just run a scan over your body head to toe and go, oh, this one, by age 50 will get cancer in whatever organ. And that is coming. I'm telling you, that technology will eventually arrive. I don't know that you or I or anyone watching this video will be alive when that happens, but I can tell you that's in the future, and it's being worked on every single day. There are people, I have a neighbor friend that her whole goal in life from since she was a little girl when she went to private school, the only thing she ever dreamed of was finding a cure for cancer. She grew up her whole life wanting to go into medical and become a scientist, about, a major in science, and be in a lab testing, and seeing what causes cancer, finding out the root cause of cancer, tracing the cause of that cancer, studying cancers. Her whole goal in life since she was a little bitty girl was to find a cure for cancer. And that's what she does every day of her life. It's for whatever reason that became her goal and her ambition. So just know that every single day there are people who are born and they are going through school, and the only thing they want to do is find a cure for cancer. I know we're going to get angry and upset. You will get more angry and more upset the more that you go through cancer, the more research you do, the more Googling, the more blogging, the more YouTube, and you check into it. Because it becomes your goal and ambition too to find out how you can cure your cancer, how you can prevent your cancer, how you can treat your cancer, how you can survive your cancer. So emotionally, mentally, physically, you're going to constantly, it will consume you, and it is so normal. You are not alone. I'm right there with you. And even when I come out on the other side, when I beat this, I am always going to be doing something to keep from cancer happening to me again. I'm already doing things right now because I did things prior to it. I know that that was God's saving grace. It's the only reason why I'm not eat up with cancer is because I was already doing preventive things, health wise, food wise, what I consumed, what I exposed myself to prevent from ever getting cancer. It's almost like I had some kind of sixth sense in the back of my mind. Um, Maybe the luck of the draw because I've always been the underdog in my family and things. I've always been the different one, the unusual one, and things happen to, and it bypassed everybody else and hit me. And so it was almost like a sixth sense, like I just knew something. And so I made measures to prevent it, and I know that that's why I'm not as bad as I could be. Um, but I also have tweaked those things since my diagnosis of cancer to fortify and do more to make sure that I'm covering all the bases I possibly can to ensure that I can hopefully prevent once my cancer is dealt with and they remove my tumor surgically and then I have radiation to go through. There I am already doing things to somehow prevent it from getting worse or metastasizing or doing it. Don't think the battle is over with. Because once you've had cancer, your probability of having more cancer, oh yeah, it's up there, about 100%. You're no longer going to escape it because I'm telling you, every ache, pain, or unusual thing that your body begins to feel, you will be so in tuned. Your alert antennas will be on highest alert, full fledged, 100% of the time. And the first thing that your brain's going to think is, oh my God, is it cancer? Well, during chemo treatments and things like that, they're not going to send you for more imaging. One, it's very expensive, and number two, they have kind of an idealism that they're going to just physically check your breast. And what they're trying to do is one, kill the cancer, and number two, shrink it. So unless you're having other symptoms, other issues, you're finding other lumps and other things going on with your body, maybe you're getting sick or you're having just resistance and trouble handling the chemo. Unless there's just something going on with you, it's not going to prompt them, and they're not even going to allow you or have you to go take any kind of imaging or screening or scanning. Which, with your breast cancer, you've already identified a lump, and you're going to notice changes going on with it as you go through chemo. So I can tell you this: I've had my third chemo treatment. Tomorrow I will receive my fourth cycle treatment of the same one I'm already on before they change it to the stage two of chemotherapy. And that is more intense because it's weekly. So at this point, they've already got my body to that point to where they feel they're stopping the cancer per se. Now it's a matter of shrinking the tumor. So they're shocking the system to kill off the cancer. Of course, they're killing off all good and bad cells. And now it's going to be a matter of shrinking that tumor. Well, I can tell you that my tumor is changed in shape, size, just in 3 cycles. But remember, this is the strongest level of chemo. And I pray that if you are watching this, maybe, just maybe, you will not have to endure this type of chemo. It doesn't mean you're going to be exited from chemo. It's just that they may choose a different type of chemotherapy. There are other medications, something that might be a little bit easier on your system. Maybe your cancer type of cancer can be combated a little bit easier, more effectively with something a little bit less. And with inflammatory breast cancer, they literally throw everything, including the kitchen sink, at it. I mean, they go at it strong because it is a very invasive cancer. Because remember, it is affecting the tissue in your breast, outwardly and inwardly. It's no longer encased, so to speak. It's not staying stute in one place. It's not SITU and it's not DISC. It's like, you're not in suit, you're not in deceit. It is now in the tissue of your skin and underneath your skin in your fatty tissue of your breast. And that's over and above the ductals and the lymph nodes. So it is hard to combat it because you're talking about your largest organ. Okay, so it's very, very invasive. So they gotta attack it fast and hard. I mean, give it all you got. So just be aware of that there are just some cancers that, of course, they're doing me textbook style. This is bona fide textbook chemotherapy at its heavy dutyest, and I know it because they they've got to combat it. They're going to do everything they can. Number one, I'm young enough, two, that I all of us have a chance, but in their look at it, they're going, oh, well, she's young enough, she can overcome it and combat it, and I feel like my probability of surviving the chemo and surviving the treatment of the cancer and surgery and radiation, this whole thing. So they look at all that and they don't just come up with some idea, oh, let's just do this treatment. There really is a scale and a level that they determine this by. You have to have certain qualifications per se for it to apply to you. So just have a positive attitude. Now, I'm gonna do a video telling you more about these chemo medications that I've taken and what exactly are they. So please stay tuned, subscribe if you haven't already, but at least turn on notifications so that you receive notification about the upcoming videos, and that way you can get that. Because remember what I told you in previous videos, if you have binge watched any of the videos I put up about my cancer and I'm giving it its name, you will discover other things that I've already told you that you can expect, what's going to happen, and give you as much information as I can because I was hungry for the information. That's why I've told you in previous videos. You will be hungry. You will be starving for more information, trying to get some kind of handle or grasp, like soaking like a sponge of information on somebody who's truly going through it. Not these doctors who are getting on there going off about, these treatments and the medications. They just try and make like they know something. Neither one of them's had cancer. And the ones that have had cancer, I tell you right now, they are making money off the click. Is clickbait. They're making money off the click. They're telling you inaccurate information. I know of one, and I have become so disappointed with her. It is disgusting because now she's all about, talking about it. Number one, she's not been a surgeon since she had her mastectomy. She can't do surgery anymore. And to me, she's behind in the times because that's been 10 years or some years ago, and she's not up to date. Furthermore, she's putting down other treatments that people are going through simply because it wasn't her guiding it. She wasn't the oncologist involved. She wasn't the surgeon involved. So she's putting down these treatments. So be careful with some of these doctors. Even if they've had cancer, make sure you pay attention to what you're saying. Listen to them real close. Also pay attention to how many times their videos has been viewed. Look at how many subscribers they got. And look at how many times they've been invited to a podcast, or that they're talking about their book. They're talking about the sales of their book. They're talking about people buying their book. They're talking about this, that, and that. Trust me, they are now all about them making money off the sickness that they endured of cancer, and they're giving inaccurate information. They need to keep up to date. They think that because they've talked to a few people on YouTube that are doctors, that they somehow done the research. That's wrong. They didn't do no research. If you are not looking and reading the doctor's journal that's published for all physicians and staying up to breast on trials and tests and things that are going on, and suddenly you decide to duplicate the title of the same thing that another doctor on YouTube is talking about, and then you're going to put your opinion on there, and then your opinion is going to impart that you disagree with this and you disagree with that. But everything she comes out her mouth contradicts the previous thing that she just the sentence she just said. So if she is not for you, the way I see it, she's against you. Because if you're a doctor, you're supposed to, and you've experienced cancer, then be objective. Be objective. Give people the information, give them accurate information, do thorough research. Because if she was a surgeon like this half-ass stuff she's putting on her videos, I'm kind of glad she ain't in the industry anymore, okay? Let's just put it that way. And I have given my honest opinion. You're supposed to be objective. You took a sworn oath to save lives, to never cause harm to a human being, to only do it for the good. The Hippocratic oath, you are not supposed to give your opinion. Now, you can have your opinion, but make sure you say that on the video rather than influencing people to make them feel that this is a bad thing. Because I'll tell you, she ought to know better. If she's had cancer, she's had surgeries, she could prove that. You can see it on her. Her earlier videos, when she was more pure, when she really had her diagnosis, had her surgery, suffered it all, they're really good information. But these newer videos, I want you to bear in mind 2026 is the year. These newer videos she's doing where she's against these unorthodox things that I know for a fact do work. You don't need a trial test to prove it. It's just people's testimony. Be objective. Don't go in there and say, oh, but that's a bad idea and this and that. No, because I was a surgeon. I'm an oncologist, da 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 da. I'm an herbalist. But I know there are thousands of herbs and thousands of antidotes to fix things. Just because I select certain herbs and I do a certain type of herb or certain type of medicine or tincture or decoction does not make it the only one available or that it will work for you. There are thousands of other options. There are thousands and hundreds of other people who are just as good as I am who offer something. And if you are fighting a disease or fighting a symptom or fighting a sickness, fighting a bacteria, anything, try it all. Throw the kitchen sink at it, okay? Do not just rest on my opinion. Check them all out. And just know that with all the love in my heart, I want you to take care of you and to be healthy and get healthy and do whatever you need to do to make it right. Because you know what? You're important. You are special. You won the ultimate lottery when you were born. So if God didn't want you born, you would have never existed. You won the ultimate lottery already by being born and being on this earth. Your job is to give it back. Play it forward. Leave as much of you here as you can until it is time for you to be taken. And that don't mean cancer gets to decide for you. Because remember, cancer is a cell that roams in every single human being that's born. It just went rogue. For whatever reason, that thing malfunctioned and it got all bent out of shape and it started duplicating itself 1,000 times faster than your normal cells. And it's it's being a menace and running rogue. And I'm telling you, people talk about fighting cancer. I'll give you a video about my opinion on that, and it will be stronghold as I am right now. So stick around, look for upcoming videos, like the video, share it with somebody that you think is as strong man as me who might benefit from the information. Of course, they can forward through the parts they don't like. Take care of you, stay beautiful, and know that Elizabeth, she's pulling for you. And I'll be your biggest fan. Thank you so much for watching. Mwah.